Hi, everybody. Welcome to my semester project part two. My topic is SPMI and homelessness. So let's jump right into it. So first, what is SPMI? SPMI is pretty much a severe and persistent mental illness that includes disorders like schizophrenia, bipolar, autism, OCD, and major depressive disorder. Um, this is a big part of the population in the United States that are affected by this, and even more so for people that are homeless. So, homelessness in the US is also a big thing. There's more than 650,000 people that suffered it last year. Um, and out of those, over 100,000 were children. Um, Homelessness has increased in 41 states between the past couple years. And the per capita rates of homelessness in states like New York, Vermont, and Oregon are the highest. So the SPMI and homelessness correlation is pretty evident. Um, People with SPMI are 10 to 20 times higher um, likely to likely to be homeless than somebody who is not suffering from SPMI. They can go to state facilities um, or local hospitals, but they're 36% more likely to have experienced homelessness either before or after their stay. So the agency that I decided to research was one that was right down the street from me. It's Zest for Life Counseling. They have offices in American Fork, Holiday, Payson, and St. George throughout um, the state. So the mission for Zest for Life Counseling is to help you, to help those you love, regain your zest for life by improving your mental, emotional, physical, spiritual, and relational well-being. They work with children 7 and up. They also work with adolescents and adults, and they do um, counseling for both individual and group settings. Um, the clients that they have are from all kinds of backgrounds, cultures, and situations that require different needs from the therapists that work with them. Um, they do offer internships for students who would like to work in the field and gain experience. Social workers can expect to intern with them until their master's level, at which time they will start doing therapy for clients. But being part of the internship does require them to be part of the intake team. So they do psychological assessments, screeners, substance abuse, all different types of screeners. And they also meet with the treatment team on a weekly basis, just to kind of gauge where the patient is at and what needs to be done to provide services for them. All right. Hi, Laura. How are you?
I'm good. How are you,
Good,
Jason?
good. Thank you so much for seeing me today on this busy day.
Yeah,
So I just wanted to talk to you a little bit. First, thank you so much for seeing me. I know that you are is it LCSW, correct?
I am an LCSW.
Okay.
Yes.
Can you tell me just a little bit about your background and how that came to be?
Um, I graduated from the University of Utah in 2005 from their MSW program.
Okay.
Um, I worked um, substance abuse my first year, and then after that, I began working at a community mental health agency, and
Awesome.
I've been there for about 18 years, and I've
Awesome.
had part jobs outside of that from here and there.
Yeah, so I know currently you work at several different places, right?
Yeah.
Okay. And other than Zest, what are the other places that you work at?
So I work at Wasatch Behavioral Health,
Okay.
and then I also have my own LLC where I consult with intermediate care facilities for people with intellectual disabilities.
Oh, okay. Awesome. Awesome.
Yeah, it's a fun
So we're just
population.
gonna, yeah, yeah, you're all over the place, yeah.
Yeah.
So just the focus today is just gonna be on Zest for Life counseling and then the SPMI and homelessness. So can you
Okay.
just tell me like a little bit about Zest for Life?
So Zest for Life is a mental health agency, basically, right? We have offices in Holiday, American Fork, Payson, and St. George. And we do basic outpatient therapy with like accelerated resolution therapy or CBT or other types of talk therapy.
Okay. Okay. Can you tell me like what are the social workers like responsibilities at that agency?
So we have social workers, we also have um, MFTs, all kinds of different licensure. But the responsibilities there are it's individual therapy or family therapy or couples therapy. So their main responsibility is the clinical work that goes into the individuals.
Okay. Do you guys have subsidies there?
We don't yet.
Okay. Okay.
We've talked about it.
All right. Um, and then for the I guess just a particular like person coming in, like say working in the intake team, what's like a starting salary? Do you know?
Oh, I am more on the clinical side.
Okay.
CEO is more about the business side. We do have like a structured pay scale
Okay.
depending on like how much a person wants to work.
Okay. And then are there opportunities for like advancement there?
Yeah, we actually have had a lot of people advance within the company.
Okay.
All of the administration team started out as clinicians.
Okay. Um, let's see here. Do you know, are there, what's the organizational chart for that company? Like,
Um, like names, is that what you're wondering?
yeah, just, I mean, like, how the structure goes, like who kind of oversees everything from the top down? Because I know
So
you're the officer, right? You're
I'm the
the
clinical
medical
officer.
officer.
Yeah. So there's basically three of us. Um, there is me as the clinical officer, and then Kylie is the chief executive officer.
Okay.
Then there's also Lucy, and she's over like payroll and facilities and things like that.
Okay.
And sorry.
That's okay.
Um, and then so under me, I have a clinical director
Okay.
as well as a director of clinical. I don't remember the exact title, but he's over our clinical education, basically, over
Okay.
our training and that.
Okay. Awesome. And then how many social workers would you say you guys have in the company?
Um, we have 20 something, I want
20.
to say.
Okay,
Yeah.
cool. All right. Well, thank you so much for telling me all about that. I wanted to jump in, if that's okay with you, about the SPMI and homelessness topic. Um, are you, let's see, I know you work with SPMI a lot, right? Is that correct?
My whole career. Yeah.
Your whole career, yeah. Okay. Can you give me just a little bit of a basic understanding of what SPMI is?
So SPMI is a term it's an acronym, seriously, persistently, mentally ill.
Mm.
It's a designation given to people over 18 if they meet certain criteria that their mental illness is kind of pervasive and ongoing.
Okay. Okay. And would you say that's pretty abundant here in Utah?
Um, I kind of have a skewed view because that's all I see.
Okay.
So
Yeah.
sometimes I think,
Sure.
well, everyone's mentally ill, but
Yeah.
I see a small population.
Okay. Um,
But we have quite a few people with pervasive mental illness in Utah.
okay. And what are like some of the treatments for them, depending on the actual diagnosis, of course? Um,
Um, for SPMI, usually we lean towards medication first,
okay.
right? Because if you're looking at like an SPMI population, you're looking more about like bipolar disorder,
Mhm.
schizoaffective disorder, schizophrenia, those types of diagnosis that really impacts people's functioning.
Yeah. Yeah.
Uh, but there's also a lot of different modalities. Like there's one that's used at the state hospital. It's cognitive behavioral therapy for psychosis. It's actually really great. Once you get people on some medications, you can help them gain some insight and things.
Okay. And would you say that um, obviously being homeless is going to affect their ability to get those medications?
It depends.
Yeah.
Yeah, we have a big homeless population. Um, and I'm speaking mostly in Utah County.
Okay.
Being homeless doesn't limit their ability to get treatment. I have a lot of clients who are homeless that still gets treatment, and we're able to help them as much as they'll let us, basically,
Okay. So it's kind of up to them.
in a lot of ways.
Yeah.
Yeah, I think that we also have a very big drug problem
Mhm.
that impacts people's abilities to make super good decisions and rational decisions, and it gets in the way of them just being able to have stable lives in general as well.
Sure. Yeah. Okay. Um, do you think that do you think it's easier for somebody with SPMI to become homeless? Um,
Yes.
yeah. And then
Yeah, and stay homeless,
and
right?
stay
Because
homeless. Yeah.
there are a lot of resources for people who become homeless and have the ability to kind of work on it and access resources.
Mhm. What do you think are some of the needs that need to happen locally that we could change to get people who have SPMI and are homeless back into a stable living situation or like back into society?
The cost of living has to come down.
Yeah.
There are these absolute dump apartments in a little town that we used to be able to get our clients in. It's a studio. Basically, you can have a hot plate in there. Like, it's nothing great.
Mhm.
They're rent like 940 a month.
Oh, wow. Okay.
Yeah,
Yeah.
even people with housing assistance are having a hard time finding places that they're able to rent.
Yeah. That
We've had a lot
unfortunately. Go on. I'm sorry.
we've had a lot of clients have housing vouchers,
Mhm.
or it's a subsidy, basically, where they only have to pay 30% of their income towards their housing, but they can't find anyone to rent to them because no one's willing to pay the prices that housing will cover.
Right. That's terrible.
Yeah.
One of the articles that I was reading that I had to research was saying that even with the allowance and the housing help, that's 95% of everything that they have. So if
Mhm.
you factor in food and everything else, they're not going to pay for it. They don't have the ability to. Um, and then job wise, how does that look for them? Is that because that's a huge factor as well, right?
Let alone the stigma, right? Like, if I have a client that's looking for an apartment, we live in Utah County.
Mm,
If being interviewed by the landlord versus like a BYU little couple
hmm.
being landlord,
Yeah.
it's more likely that my client won't get chosen.
Sure.
Sometimes it's great. We actually have some landlords that will reach out to us and want to work with us with our clients,
Hmm.
which is super great, but it's not a lot. Sometimes our clients are hard to rent to.
Yeah. Are there certain agencies that, not counseling agencies per se, but like places that somebody with SPMI that's homeless could go, um, for support? Whether like any kind of support at all.
If they want treatment, there's all kinds of places to go,
Yeah.
right? Like Wasatch has a mental health treatment right in the Food and Care Coalition.
Okay.
So if people want mental health treatment, um, they even have a grant that will help pay for that. Like they
Okay.
don't have to pay Medicaid, but we will help them apply for Medicaid. There's also crisis centers throughout where we're not homeless agencies, like we're not homeless shelters, but if someone wants mental health treatment, we
Hmm.
will help connect them to that.
Okay.
Or even use treatment, we will help connect them to that as well.
Okay. So they do have resources that they can go to.
Yeah.
Is there any kind of bills or anything right now that's being looked at to help them in any sort of way?
There's been a lot of talk at the state and a lot of discussion amongst like the community mental health leaders
Hmm.
about what that has to look like, and how to help with the homeless population. I part of my duty at Wasatch is I'm over the civil commitments
Okay.
for Utah County.
Okay.
And I was questioned about how many people I thought were under civil commitment, which means they're under court ordered mental health treatment,
Sure.
who were also homeless. And so I know that they're talking about ways to try to help provide housing,
Hmm.
but it it really is hard to help people keep housing.
Yeah. Yeah. Especially when it's hard for them to maintain a job, right?
And
Yeah.
not even a job, right? Like just rules.
Yeah. Just rules in general.
They Yeah. You
Okay.
have your SPL people who are a little lower functioning,
Hmm.
whether that's due to drug use, like pretty consistent drug use, or whether it's due to years of antipsychotic medications.
Sure.
Um, they have a harder time following rules, like not allowing people into their home, right? Like those
Yeah.
kind of rules.
I know I
And
see.
it
Oh,
trouble.
yeah. A lot of them at the hospital. I see a lot of patients at the hospital that are really low functioning. Um,
Hmm.
even the civil commitments too, that are going to be there for a long time. Um,
Yeah.
so any other than lowering the housing, is there any other specifically things you think could change to make it easier or more accessible for people with SPMI suffering from homelessness to, I guess, to get
There's also been, so I used to be the liaison for Wasatch with the state hospital.
okay.
And within those meetings, we would always talk about having more supported housing. So having housing complexes that would help with like the ADLs or help with grocery shopping or help them just maintain normal adult functioning, right?
Mm-hmm.
And so there was a lot of talk about that, but there's not a lot of funding for it.
Yeah. So it's, I guess there needs to be more of an advocacy for them.
Funding needs to be there, which
Yeah.
goes through
Yeah.
legislation.
Yeah.
Yeah.
All right.
And Utah operates a zero, we don't ever go in a deficit. So if money goes towards that, it has to come from something else.
Wow. Did not know that. That is,
Yeah.
yeah. That's hard to hear. Yeah. Um,
Yeah.
all right, Laura. Well, thank you so much for your time. I appreciate you talking
No
with
problem.
me. Hope you enjoy the rest of your Easter.
You too.
All right. Thanks.
Okay.
Bye.
Bye.
Okay, so that was my interview with Laura Oakes, um, the clinical officer for Zest for Life. So just some key points from the interview, about change, what needs to happen. First, the cost of living is just too high Many people with a mental disability, such as SPMI, have a hard time affording rent. I think all of us do, but especially when you are collecting Social Security disability, have a hard time holding a job or maintaining a job, that can compound everything. Another one is funding for care facilities. Legislation needs to happen for these people to have a place to go um, during hard times. And having SPMI and being homelessness can be difficult on many levels. And also, just the stigma and overall feeling of people suffering from SPMI needs to change. Uh, and on a meso and macro level, a lot of people just kind of like to put them in the shadows or shun them out, and that's the last place they need to be. But okay, guys, I hope you guys enjoyed the video. Thanks.